perfect. That's it. No.
There is more than 900,000 refugees and IDPs in the world, and all for the medical services.
I would like to congratulate the Director General of Health in Dahut. I have been hearing a lot of good things about the achievements you are making here, and I want to congratulate you, of course, with the guidance of His Excellency the Minister of Health. And we're really proud of the joint work that we are having with the health authorities here in Dahut. And this work has resulted in a number of very important achievements. What you are having now is an enormous burden resulting from the increasing number of internally displaced people. And this has resulted, of course, in this kind of burden on the health authorities here, on the healthcare services. And I think you've been able to do a great job. I think one key achievement is that we are not seeing any major outbreaks. The surveillance system here is running very well, and public health functions are very well maintained. So I would like to start by congratulating you and His Excellency the Minister of Health for this kind of achievement. We have been working very, very closely with the health authorities in Kurdistan, and also with the Federal Ministry of Health in Baghdad in addressing this crisis. This is one of two of the most serious humanitarian crises in the whole world. And we know that in our region, unfortunately, we have too many crises and too many countries affected by crisis. At any one time, we have more than 50% of the countries of this region experiencing either acute crisis or chronic emergencies. But the situation in Iraq and the situation in Syria are the two most serious situations and crises. And you know that they have been graded by the United Nations formally as the most serious emergencies at the global level. And there are major risks from the influx of IDPs and also of refugees, because in Dahut we have not only IDPs, but we do have also refugees from the Syrian crisis. And despite this increasing number of IDPs and refugees, and the huge burden on health services, the increasing demands, I think we have been able to, working together, we have been able to prevent disease outbreaks, but at the same time respond to the acute health needs of the displaced population. So this is something that we're very proud of. We are proud of the partnerships we have with you. I want to give also, or add my congratulations also for our colleagues within the UN system and also our colleagues within the health cluster, the non-governmental organizations that are represented here in this meeting, and those who are not, have not been able to attend here, because we work very closely. Anything that WHO achieves in the health cluster is achieved because of the excellent working relationship with other partners we have within the UN system and also with non-governmental organizations. I would like to thank them all for their dedication, for their excellent input, and also for the excellent coordination. I hear that in the work there is very good coordination between all the members and the health cluster, and I hope that this will continue and will be strengthened. As I said before, why we are here is to really review the situation here, review our collaboration, try to also discuss the possible scenarios. This is not a static situation. The situation can change. And so we're very much interested in also reviewing with His Excellency the Minister of Health and the national health authorities and the government officials the possible scenarios in terms of based of course on the political situation and also the events that are taking place in this region, to make sure that we take the necessary actions to ensure that we act when the situation changes. We have scarcity of resources. We have to be responding to the needs, and I thank His Excellency the Minister of Health for acknowledging the support of WHO and the partners in the international community. And we are doing our best to continue to respond to the acute needs. Today we will deliver some of the support in terms of ambulances, mobile health clinics, essential medicines, and others. But the fact remains that there is a huge funding gap. This applies to WHO, it applies to the other UN agencies and also to other partners. And that is why I am really very, very pleased and grateful for my friend, the renowned musician, I think all of you know him, Monsieur Shamma, who has been extremely interested in supporting efforts of the national health authorities and also of the international community in responding to the needs of the IDPs and also refugees. So we have a program of collaboration with him to increase awareness about the urgent need for support and also for resource mobilization to support humanitarian response in the health area. And we will be discussing with the national authorities and with him how we can move forward. We already have plans that we would like to implement over the next weeks and months. So finally, I just want to go back and thank again His Excellency, the Minister of Health, and Dr. Nazar, and all the officials here working with the IDPs, and I'm delighted that I'll be able to visit some of the camps today to convey our appreciation to the work, the great work that they are doing. I want to say that we will continue to work very closely. This joint work will be even strengthened, I hope, in the coming weeks and months, and we will be working with His Excellency hand in hand to support the great work that you are doing. Thank you very much.
We're planning the first concert in Geneva soon, the 1st of June, and we will continue in, yes, this is in Geneva, we will start, and they're working about health, and it's not easy. I know the situation is very, very difficult now, not in Iraq, everywhere in the world there is problems to help the people, but we need to already start that, and I hope we will continue very well. Thank you.
Thank you. Welcome.
challenges. And as you correctly said, these challenges will become even more acute.
We actually, I've been pushing for the selection of this person as soon as possible. We were told yesterday that we have some CVs, so we will work with you to ensure that we support this. I mean, the kind of suffering that has been taking place here in the last months is unprecedented. There's so many things happening in this region that are unprecedented, and this is one of them. And so we really need to give it a much higher priority in our joint work together. So again, we will be working, and we will continue to discuss today and tomorrow, and we will try to see how we can help in a more effective way over the coming weeks and months. Thank you.
essential drugs اللي تيجي بهالشحنات شنو اللي ناقص بيها واللي تحس انه ما موجود بيها تحتاج؟
اكثر شيء يعني الانالجيسيس والانتي بايوتكس خاصه الادلت بالنسبه لنا للتشيلد لا والسكين بريباريشن تقريبا شبه معدومه.
ادويه الامراض المزمنه
ادويه الامراض المزمنه عندنا اشكال بها يعني مشكله كبيره بالنسبه لنا.
بغداد ما عندنا. بغداد يقول السيستم مالتكم مو عيادات شعبيه وهاي يعني ما ادري يعني.
لانه الامرجنسي هيلث كيتس مشكلتها ايضا انه ما تغطي هالجزء منه، فلازم يكون لازم نشتغل separate preparing the
عندنا مشاكل اكبر بالبريفنشن.
One big lesson I have learned is on how important it is to coordinate between the health partners. And so coming here, meeting the health cluster partners, I know how important your job is, and I know how essential it is to coordinate. And by coordination, I don't mean controlling, but by coordination, I mean joint work, the highest level of coordination in terms of implementing what we all agree to implement. So this is just an introduction to say how important your role is in addressing this emergency and any emergency. So I'm pleased I am here. This has been a very, very useful visit for His Excellency the Minister and myself. We went to Duhok, spent the whole day there. We saw 2 camps. We saw how the health partners are working to provide support to the government of Kurdistan. And I must say that I have learned a lot from this one full day visit, learning to understand better the situation, learning to also appreciate the achievements you have all made, in addressing one of the most serious emergencies that we are facing today, and also learning about the seriousness of some of the challenges that we are all facing in terms of continuing to do what we have started to do. The challenge of inadequate funding is one thing that we really need to work on in the coming weeks and months, and also the challenge of preparing ourselves for the different kinds of scenarios that might happen over the next weeks and months. So I don't want to make a big speech, but my message is really focusing on how important our work together is and how critical is the leadership of the Ministry of Health. I must say that I am very impressed with the dedication and the efficiency of the Ministry of Health leadership here in addressing this emergency. And one of the principles, one of the lessons we have learned in implementing the cluster approach in so many emergencies over the last years is the importance of the Ministry of Health being in the leadership role. And I see this happening here too. So I would like to thank you all.